Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Theophylline. Its brand name is Uniphyl. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Theophylline. We'll then touch on examples of dosing and finish it off with side effects. I put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Theophylline exerts two distinct actions in the lungs: bronchodilation through smooth muscle relaxation and suppression of airway stimuli. It is suggested that bronchodilation is mediated by inhibition of two isoenzymes, PDE3 or PDE4. In terms of indications or reasons we prescribe this medication to a patient, while Theophylline will be most often prescribed for the treatment of asthma, however, it can also be prescribed for the treatment of chronic obstructive pulmonary disease, also known as COPD. With respect to contraindications or reasons we would not be able to prescribe Theophylline, well, first off, we just wouldn't give this medication to a patient who had a hypersensitivity to Theophylline or to any other component of the formulation. If a patient had a known allergy to corn or corn products in the dextrose-containing solutions, they would not use this medication in the injection formulation. Now for some examples of dosing with Theophylline. So in the treatment of asthma, using the immediate release formulation, or the elixir, we would see an initial dose of 300 milligrams per day given in divided doses over 6 to 8 hours. After 3 days, if tolerated, we can increase to 400 milligrams per day orally in divided doses again over 6 to 8 hours, and then increase to 600 milligrams per day if needed after another 3 days. For the extended release 24-hour formulation, we would see an initial dose of 300 to 400 milligrams once daily this time, and then again after 3 days we can increase to 400 and then again to 600 after another 3 days. As with all medications, there are some side effects or adverse reactions that patients may experience while using Theophylline, so we'll go over some of those here now. Some common side effects may include nausea or vomiting, as well as a headache or insomnia. Some patients may experience a tremor or irritability and even restlessness. Some serious side effects may include atrial fibrillation, an intracranial hemorrhage, a seizure, or a tachyarrhythmia. Alright everybody, that's all we're going to talk about today with Theophylline or Uniphyl. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.